We might be low on batteries. I can go run and grab some.
Can I talk without it?
I'll get it, Val, don't worry. Yeah,
Can I talk without it?
if everybody can hear you.
Okay, can everybody hear me? I've got a booming voice.
There are a couple more batteries in the cabinet.
Oh, okay, okay. Let's try to swap them out
I'm
then.
gonna just, I want to start with a warning, how the speakers start with a warning. I'm gonna start with a warning that we have massive amounts of data to cover. And that's what we're gonna do, because what I found about homelessness is when somebody wants to talk about it, generally they're talking from emotion and not fact. And what I want to do today is just give you as many facts about an introduction to homelessness and the history of homelessness, and then I don't expect you to remember them all. I'm hoping that you will leave with a global understanding of the subject. And as I said to Bob, if I can come back after Easter, if I can come back after Easter and we can do a talk about all of it and kind of process. So today is going to be fast and furious. Don't expect to remember the facts. Just let it kind of all wash over you, okay? So we're going to do an introduction to homelessness. That's me. So we're going to do an introduction and the history to homelessness. Here we go. So I'm going to offer a couple of things that are going to make you think a little bit. This is one of them. The unresolved debate is whether homelessness is predominantly a health issue or a housing issue. Is it either or and? I think by the end of this you're going to think and. All right. Homelessness is a social construct derived from multifaceted suffering of the very poor. It's something that we have created to say, what is this that's happening to somebody? This is called homelessness. But we have created that. So it morphs and changes and grows in its definition. And we'll go over that as well. This is interesting to me. When it comes to poverty and social welfare, Americans have always been conflicted, and that conflict lies deep beneath the surface of much of what we do and much we say. Believe it or not, this all starts with the puritanical founding fathers who believed that hard work and material success indicated those being chosen by God, and poverty indicates the opposite. Along with that, we add Darwinism, which some people believe in, that say that people have to solve their own problems, and those who can't are simply unchosen or have lost the battle in the arena of the survival of the fittest. Now let's think about these real quickly. Number one, how many times have you heard people say, well, if those people would just work harder, they wouldn't be homeless? Raise your hand. Those puritanical underpinnings are still in the belief system of the United States. And then Darwinism, hey, if they're not strong enough, let them deal with who they are. Anybody heard that before? Something similar to that? So these things still influence our belief in people that are unhoused. What is the definition of chronic homeless? Have you ever heard this? Oh, that person is chronic homeless. What that means is, according to the department according to HUD, these are unaccompanied homeless individuals with a disabling condition who have been continuously homeless for a year or more, or they have been an unaccompanied individual with a disabling condition who has had at least 4 episodes of homelessness in the last 3 years. These are the folks that have been on the street for a long time, or episodically on and off and on and off and on and off. These are truly the people that we focus a lot of time on trying to figure out how can we help these folks. So that's just one category of the people who are unhoused. Let's look at the other 3. So we just went through chronic homelessness. The second is called episodic homeless. And these are people who are currently homeless, who have experienced 3 episodes of homelessness within a year. And these two conflict a little, what HUD says and what this says. But these are mostly episodic people who on and off again, they're sleeping on a couch and then they're on the streets. Their mom says you can come back, but then they're on the streets. These are the people that are considered episodically homeless. Transitional homeless. These are the people who have temporary residence, shelters, transitional housing. Transitional homelessness is usually, but not always, a result of major life changes or catastrophic events. And if an individual or family does not enter the cycle of homelessness, it's not usually a reoccurring event. This is when somebody suddenly loses their job and they didn't have anything in savings. It's when somebody's mother becomes really ill and they have to quit their job to go help their mom. It's episodic episodes, usually personal episodes. Hidden homeless. These are the tough folks to find. These are the people who don't have permanent housing but are not living on the streets and shelters. They're living in campsites at Washington Park. They're living in their RVs on T Avenue. They are living on somebody else's couch. These are the folks that are often hard to count. So these are the 4 classifications of homelessness. Yes. Oh,
I'm wired. There we go. There we go. Okay. So, I'm going to dispel some things that you thought you knew, but maybe didn't know quite correctly. The average length of homeless for shelter and street people is less than 6 months. The average length of being on the streets is less than 6 months. 78% live in urban areas. Metropolitan areas of 250,000 or more population have a homeless ratio of about 13 homeless people per 10,000 residents. Who thinks that's higher than you thought it was? Who thinks that's lower than what you thought it was? Okay. I think in some cities, particularly on the West Coast, Seattle, Portland, LA, the numbers are higher than 13 per 10,000. Really interesting statistic. More families are homeless now than were in the Great Depression. Who's that surprised? Yeah, I think that's just a stunning statistic. The average homeless family is headed by a woman under 30 and is a member of a minority group. Under 30. That's the face of homelessness for families now. Did you know, these are going to surprise you, I bet. Did you know that although an average of 40% of the homeless work, how many are surprised by that? 40% of the homeless do have a job. It is most often at low-skilled, part-time, or day labor jobs with minimal paychecks and no benefits. Right? They're day labor. Nobody's giving them benefits, and they're not making enough, particularly in Seattle, Anacortes, Mount Vernon, to be able to afford a place to stay. 66% of the people experiencing homelessness have some sort of legitimate income. Jobs, SSI, Social Security, we'll talk about that, SSDI, disability, Social Security. More than half of the homeless population have a high school diploma. 50% have a high school diploma. And up to 1/3 have a post-high school education. Is that surprising? 1/3, 33%. I don't have the time to tell the story, but the first person I met, the first time I stayed at a homeless shelter to volunteer, had a PhD in British literature from school in England. They called him the professor. He was really smart. He was just bipolar. So a lot of these folks have great education. Did you know that, we're going to dispel a rumor or a legend, urban legend is in Seattle that it suggests that homeless are highly mobile, but studies do not support that contention. Overall, 40% of the study sample had been born in the country in which, county, in which they were interviewed. In other words, 40% of the people are homeless where they were born. Another 24% have lived there for more than 1 year, and then a third of the people had less than 1 year in that county. Now, why is this important? How many times have you heard people say, well, you know, we're just so generous up here in the Northwest, particularly in Seattle. People are flocking from all over the United States to come here to get all the services. Anybody heard that? Yeah, not necessarily true. This is a really important concept. If you get one concept out of my ramblings today, I would like you to understand this. And that is that homelessness is more like a river than it is a lake. Most people do not stay homeless forever. On any given day, some find housing and others become homeless. Thus, far more people are homeless over an extended period of time than on any one given night. And I think we're going to talk about this a little later, but I'm sure you know about the point in time count where people are counted, how many homeless each community has. Well, that's for one night. But the problem is, this is a vacillating number. Day by day, it changes. The number of people who are homeless is very fluid and not static, as often thought. The point in time count shows that we have 92 homeless people in Hortus, that's the night that it was counted, or the day it was counted. The next day, it'll change. So it's very, very fluid. This population is determined through a snapshot of time, the point in time count. As noted, the circumstances for homelessness can take various forms, and we've talked about this, people being unsheltered, living in the streets, camping, abandoned buildings, housing doubled up. So this is all people who are homeless, as we've discussed. But the most important thing to remember is this is an extraordinarily fluid number. And the problem with that is a lot of the government's funding of homeless services is based on what? The point in time count. One night's count. The next night it could be 20% more. You just never know. So it's not a great system that we have in place right now. At its core, homelessness results from an inequality between a household's income and the cost of its housing. Now, when I first read this statement, I thought, oh, you just can't make it that simple. But in truth, you can. I can give you 100 examples of how this fits. It's the person I talked about who becomes ill and can't work anymore, so he doesn't have an income coming in. What happens? The cost of his housing, he doesn't have enough money. Almost everything comes down to the fact that people simply cannot afford housing, and that's what's causing homelessness. So when people say, is homelessness just an issue of housing? The answer is no. It's often an issue of an ability to have enough money to pay for the housing. There are 3 factors that cause homelessness. This is kind of an interesting piece of information. One is structural, and what is structural? Structural are society trends and changes that include housing markets, employment opportunities, fair wages. These are global things that can affect homelessness. The second thing is individual. This is what we've talked about. Conditions and circumstances such as disabilities, mental illness, etc. It's what is going on with that person. And then finally, public policy. And I don't know, quite frankly, I don't remember if I had time to put these slides in or if I thought we'd have time to go over them. But I think we're going over some to show how the government's changes in their thinking on homelessness directly affects the homeless numbers. We'll try to get to that today. So, few things are black and white when you're talking about homelessness. Should we provide assistance or should we provide shelter? Should we be compassionate or generous?
Or should we exercise social control by rewarding work and industry while penalizing idleness and intemperance? What people see things very different, don't they? Some people would say some of those things. Some people would say the other things. All these ideological conflicts can easily be seen in the history of many U.S. safety net programs. We'll talk about those in a minute. We want to help, but we don't want to help too much, and not those undeserving poor. And you see that in quotes. I just even hate saying that that sentence, but there are a lot of people who feel very strongly about the undeserving poor. So we have to put that up there. So here's what really happens in our country. Congress passes, so this is an example. Congress passes a program and a flood of funding expands eligibility when the level of need becomes a crisis and the public outcry increases. Then funding decreases and contracts eligibility when the program starts to cost too much or when those, quote, undeserving people are perceived as taking advantage of it. Now let's look at where this happens. Let's say, so there has been a problem with people living on the streets, hasn't there? And there's an outcry. Everybody that lives in urban areas is screaming, saying, we gotta get these people off the street. Well, yeah, we gotta get these people off the street. So they go to what? They go to their congressmen, they go to their senators, they go to their representatives and say, we have to do something. And the groundswell begins, and then they all decide something needs to be done. So they create legislation. And with that legislation comes money. And so what happens? This flood of money comes in to help the homeless. It's wonderful. It's great. We're going to get them off the streets. It's fantastic. But then people are either saying it's costing, oh, this is costing us too much. We can't afford this anymore. Those people, they don't need it anymore. What happens? They take the funding away and eligibility constricts. And this happens over and over and over again. So we have services, we don't. We have services, we don't. This is a problem with our system in our country. All right, so that's an introduction. Kind of get it? I mean, that's a really fast introduction to homelessness. Now we're going to take a look at the history of homelessness in our country. That's a picture from the 1920s of some homeless folks. Homelessness in the United States is not a new condition. It was present in one form or another since at least since the second quarter of the 18th century. It's been around for a very long time. The demographics of those who are homeless, however, have changed through the years. For example, in the early periods, and I find this fascinating, oh, not this one, but in early periods, 1865 to 1930, veterans comprised about 1/4 of the homeless population. Then if you fast forward to the 1950s to the 1980s, there were relatively few veterans that were homeless. Today, the percentage of veterans has crept back up to about 20%. Now the thing I find interesting about, and this is a government statistic, anybody that wants where this is, I didn't footnote all of this, but anybody that wants the information, I can get it to you. The thing I find interesting is that when the veterans were coming back from the Vietnam War, they were finding housing, which I find very interesting. A similar ebb and flow can be seen with women and homelessness. This is what I find really interesting. Prior to 1870, women made up a significant number of the homeless. That surprised me. I didn't think of women being homeless prior to 1870. By the end of the 19th century, the world of homelessness had become primarily men. There was a dramatic increase in women after 1980 as single adults and heads of households. And we'll talk about why this happened in the 1980s, but I just find that really interesting. There were that many homeless women before 1870. Over the past 200 years, society's explanations for the phenomena of homelessness have changed. It's a changing phenomenon. During the Great Depression, persons without homes were much more likely to be seen as victims of a force that was beyond their control, a structural force, like we talked about, structural forces. Therefore, worthy of sympathy. Remember, during the Great Depression, people were in soup lines and people were on the streets, and people had a real heart for these folks. This isn't their fault. But then, post-Depression era, homelessness was associated with urban areas and was well confined to places like Skid Row. That's where the homeless stayed. We're going to keep them right there. The sympathy is starting to wear off. And today, homelessness is much more dispersed. It is mostly in urban settings, but as we know in Anacortes, homelessness can be found in rural settings too. Okay, here we go with the give and take and give and take and give and take. In 1965, in the United States, began to empty their mental hospitals with the enactment of the Medicaid program that made it possible for states to pass responsibility for much of the cost of housing and treating people with mental illness to the federal government as long as patients lived in a community rather than a state institution. So what happened? We're closing down our mental institutions. Here are communities. You take them. We'll pay for it. It's a great idea, but what happened? They didn't pay for it. So people went back to the communities and they didn't have enough funding to be able to support the mental health needs of the people that were coming into their communities. Because of the recession in the 1980s, unemployment rates reached 25%, and more than 1% of the country's population was homeless. 1%. That's 2,700,000 people were homeless in the 1980s. It's a huge number, isn't it? When you put it all together. During those years, increasing numbers of women and whole families began to appear in the homeless facilities with few accommodations and programs. When I first started working in shelters, very few women, not a lot of women. And now, as we've seen, a lot more women and families. In the 1980s, Congress took its first steps toward involving the federal government in homeless relief, authorizing the first wave of emergency food and shelter programs as part of the Job Stimulus Bill of 1983. Most of us remember that Job Stimulus Bill. So, okay, Congress says, we've got to do something here. We've got a recession. We need to get food and shelter to people. So they funded that in that bill. The result was a significant increase, as we've talked about, in the portion of people suffering from mental illness and among people experiencing homelessness from an estimated 20% of the people who were homeless to a single point in time where it was 33% in 1982. I apologize, something happened to this because this should be under mental health. But it doesn't have to do with the recession and the stimulus bill. But it shows you that during the recession, look, in 2 years, the number of people that were suffering from mental illness went up 13% in 2 years. Because why? People went back to their communities and there was no money to fund their programs. So here we go again. In the 1980s were not a good decade for the homeless. So a major loss in the 1980s was for the people with disabilities during the Reagan administration, making it more difficult to receive SSDI, which is Social Security for people with disabilities. At the same time, many states were cutting back on state-funded welfare. Together, these cutbacks meant that the people who were already poor faced increasingly difficulty in being able to afford housing. So what happened? The federal government says, we're going to make it a lot harder for people to get SSDI. There must have been an outcry, too many of those people are getting this money. So they said, okay, we're going to make it harder. And then states said, well, if you're gonna do that, we're gonna cut back on state-funded welfare. It was a double hit for people that were low income or were homeless. In 1982, the recession dragged to a conclusion finally, and the economy started to pick back up. But the crack cocaine epidemic ended any reduction in homelessness that one might have expected as people went back to work. Suddenly people were losing their jobs because of crack cocaine. The healthy trends were countermanded by huge increases, as we all know, in crack dependencies. Look at this. ER visits increased 9-fold between 1976 and 1985. 9-fold because of crack cocaine. In 1996, Congress passed the Contract with America Advancement Act. And this terminated benefits for SSI and disability for those who had drug addictions or alcoholism. Let that sink in for just a minute. The people who had those disabilities lost their disability insurance. So the major difference between SSI, if you ever wondered this, and SSDI is for disabilities. In January of 1997, when the new policy went into effect, or shortly thereafter, almost 108,000 people who were eligible based on substance abuse disorders lost their eligibility, comprising 64% of all people on SSI or SSDI. Now, why are these kind of statistics important? Because people say, what are those people doing on the streets? Why are they on the streets? Because the government keeps giving them help and then taking it away. And people with disabilities lost their insurance, 108,000 of them. So the recession had a major impact on family homelessness. Families were hit hard by foreclosures. We all remember that foreclosure crisis, right? Housing loss happened to homeowners because they couldn't make payments on subprime mortgages. And when the effect of the subprime crisis were beginning to materialize, the number of homeless, because of this crisis in the early 2000s, reached 236,000 just from the housing crisis, the subprime issue. So we just keep adding to the numbers and adding to the numbers. So here's some statistics to think about, like you need some more statistics, but let's just throw some more in. Homelessness is increasing in rural areas. We've seen that, haven't we? Where the centers of economy are declining. People in rural areas that are homeless average about 36 days of homelessness in rural areas, much lower than in urban areas. Why would that be? Anybody? Why would that be?
Just fewer jobs available.
Okay, but in rural areas, why would they be on the streets left shorter time than in the cities?
Housing is less expensive.
Okay, housing's less expensive,
They might be taken in by family and friends.
right? Community. The community comes into play, right, Nick? A third of all homeless people in the United States are found on the West Coast, even though only 19% of the nation's population lives there. So as we all know, we have an issue on the West Coast, which is all landlocked, because a disproportionate amount of the homeless live on the West Coast. A recent study showed that there is no state in the country where a person working 40 hours per week at minimum wage job can afford a 1 or 2 bedroom apartment at fair market rents. Let that sink in. Not one state. You know, you think maybe Iowa, maybe North Dakota, not one state. Oh man, I really flew. How about that? Okay, let's talk about some questions.
first of all, before we go to these questions, I know I really flew. Did you kind of get an idea of what's happening? What questions? Do you have any questions before we get to these questions? Let's go to these questions and maybe you'll think of some. What surprised you the most about the history of homelessness? Why did it surprise you? Val?
I think that last statistic you gave surprised me.
Okay.
I assumed that somewhere, one of the states, you could work a 40-hour week minimum, wage job, and be able to afford an apartment.
Thank you, because you're right. Because we're doing this just for one Sunday. If I come back, I could talk about what the costs of renting across the United States are and how people literally can't afford it on a lower wage job. Peter?
Anecdotally, Lisa and I, we lived in Hawaii. When we first moved there, we used to kind of joke about how many cars were parked on the front lawn of the house, because we'd never seen that living anywhere else. And then as we lived over a period of time, each car represented somebody who was living in the house who was working. And they couldn't afford to live on their own. And you go from one car to 2 to 3 to 4 to 5, that's 5, 6, 7 people working 40-hour weeks to pay to live there, which is a very interesting thing.
Exactly. Yeah, I think there's more of that than we realize. I think the hidden homeless are everywhere, but we just don't know it. I was so surprised when I started working with the Family Center when I heard that there were 97 kids on the rolls that were homeless. Now I know that we have homeless in Anacortes, but that struck me as amazing. So yeah, I think it is surprising. Nick?
Yeah, I think just looking back over my lifetime,
Mhm.
that during the 80s and 90s, they, in many states, tended to defund mental illness treatment. It had a huge effect on the downflow down into homelessness that occurred when those people could no longer receive any help. And, you're trying to help them, but they had some other issues that really needed medical care.
Right.
And it wasn't there. The state saw that as a way to save a lot of money.
Right, and the two greatest issues, other than housing in homelessness, are mental illness and substance abuse addiction. Yeah.
So, this is specifically homelessness and funding and management in the United States.
Right.
Are there other countries that are that are managing homelessness well? And how can we learn from them?
It's a great question. I want to say that not our entire country is not doing it poorly. A lot of places are doing it well, in spite of the money they're not getting from the federal government. So I'm going to put a little plug in for my favorite place in the whole world. I had the great good fortune to help envision, build, and open the nation's largest homeless transformation campus. It's called Haven for Hope. You can find it at havenforhope.org. And it is doing it right.
Where's that?
It's in San Antonio, Texas. It is a 23-acre campus that was built out of old warehouses, and we built dorms to go with those warehouses. 440,000 square feet of building. On campus, it holds 800 people, including a ton of children, as a daycare center there, Head Start Center, and 700 people on what we call safe sleeping. Now, safe sleeping is where the folks who say, I'm not going into that program, I'm going to not stop drinking, but I really want someplace safe to sleep. So it's an outdoor safe sleeping area. There is a little indoor area, but it's mostly outdoor safe sleeping, where they can get food and clothing and help in the ways they need it, but they don't have to come onto campus. So 1,600 people at any given time. About 60 nonprofits co-locate in a 60,000 square foot building on campus. So the people that are there, any services they need are right on campus. There's a dog kennel, there's a beauty shop, there's a chapel right in the middle that is gorgeous. There's, food. That has become, I'm happy to say, I'm proud to say, one of the nation's shining stars in what can work. So that's only one example. Father Joe's Village in San Diego is great. There's great places around the country. But as a country, we don't quite have it together yet. There are countries that do, but they tend to lean more towards those who are socialized medicine. My son-in-law is British, and his father told me, I said, what'd you do with all the homeless during the pandemic? And he said, well, we had so many people die during the pandemic that were getting money from the government that we just took their money and we housed the homeless. Well, that's a great thing if you have a socialized system, but we don't in this country. So there are countries, particularly those who lean towards socialized medicine, socialized welfare, that are doing well. Does that kind of answer your question?
Hi, I'm Reed.
Can I help you?
So you, a couple of years ago, consulted to the city of Portland, Oregon. Portland, Seattle, for sure LA, and San Francisco have, you mentioned West Coast problems. Why is it that politically they can't get their act together like San Antonio did? You were on the ground in Portland and you kind of saw what happened.
Yeah.
Why are the politics in Portland and Seattle, we all know about Seattle, you drive through there, you still see it. What happened in San Antonio that isn't happening in these communities?
It's a great question, and it's really easy to answer. You wouldn't think it would be, but it is. What we had in San Antonio from the moment it was decided we needed to do better for our homeless was a public-private partnership. One of the largest business leaders in the community who started Valero Energy said, we've got to do better, knocked on the door of the mayor of San Antonio and said, you and me, we're going to figure this out. They had the goodwill of the mayor, and they had the goodwill of the business community, and a man who had a lot of clout, two men that had a lot of clout. And that's what made it happen, was the public-private partnership. When I went down to Portland and consulted with them, no matter how hard we tried, we couldn't get that alliance. And so everything kept falling apart. We had a business leader that said, I will help to fund this. I will find the funding. But we couldn't get the government on board. We couldn't get the mayor on board. This went on for a very long time. So the need for a public-private partnership is what launches this and makes it work. That's the difference between what I've seen as in successes and failures.
I've often questioned too that period when they took the mental institutions and said you couldn't lock up. Because if I had a 8 or a 10-year-old kid that said, I can do it on my own, and, left, there would be holler, but yet they take people whose mental abilities are at that range and say, well, they're old enough to decide on themselves, And I would rather, if it was my sister or my mother or whoever, I'd rather see them in a safe place where they have chores and are cared for and that, than to just say, well, they decided,
Right.
but their mental ability isn't at the adult level to make. So it seems like we let those people down.
Yeah. Yes, two things happened in the 80s. One thing is they closed the mental institutions. And the second thing was, it was a lot during the Reagan administration, they defunded public housing. And so let's look at what we have on our streets right now. What do we have? We have people with mental illness who have no place to go and no money to get care. That's what you see downtown on the streets of Seattle. And we have people who can't afford housing. In Seattle, the lower income neighborhoods are being gentrified so fast
that these people are losing housing and they can't find any that they can afford, and they've had houses their whole life. So unfortunately, if I come back, we'll talk about housing, we'll talk about mental illness and substance abuse, but with both of those things hitting at the same time, that we're defunded and moved, that really is a picture of what we've got now. Elizabeth?
Well, I do have an example of a positive way that churches can function, because in the 80s, when I was living in West Virginia, when this happened, when they kicked everybody out of the mental health institutions, and Arnold, who was about 8 functioning mentally, was given a bus ticket to Parkersburg, West Virginia, and he ended up in the bus station, and somebody brought him to the church. And to make a long story short, Arnold was adopted by the church, and Arnold stayed at the church all day, just sitting there, and if you came in, Arnold made you a cup of coffee. That was his job. And saying, hello, and he would hand you, and the congregation then, we just kind of took turns and having him for dinner, and eventually got him into a community housing. But Arnold became the face of welcome
I love that.
in his simplicity. But that's what he did. He had a ticket, bus ticket, with absolutely no plan for him. And he ended up
Yeah.
in the church community.
I think that's a great example of, we don't want to say the government has to do everything. That we as communities have to step up and assist. But I would say that if we go back to the 4 types of homelessness, if you have the folks who just lost their job and you can scoop them up and get them another job and get them into the house or keep them in their house and pay whatever needs to be done, simple. The people who have some language barriers that have come into our country and they need some language help, or people who really want to beat their addiction, but they need time to do that. Those folks take a little more time. And then you've got the chronic folks. I think for the first 2 groups of people, places like churches, organizations, to be able to help are imperative. But I think that working with the chronic homeless is so difficult that that wouldn't be something that this is just my opinion, that I wouldn't say to a church, you know, that's a great ministry for you, unless people have the training to do that. Any other thoughts? Yeah, Lynn.
A lot of things circling here, but people who know me know that's a problem. My brother was homeless for a long time, and he was raised just like I was, in a home where we expected to go. He did go to college, get a college degree, and what brought him down was addiction. But even when he kicked that, he didn't have the vision anymore to see himself living as I did. He couldn't see it.
Right.
And I got a whole new perspective on what happens to people when they can't even envision being better than what they have.
Right.
I mean, he eventually lived in a hotel for a long time, like one of the pretty bad hotels in Los Angeles, and then he actually got an apartment when he got some inheritance money, but it was just, he couldn't see himself living out of that community. He couldn't see himself, although there were services and places he could have gone as he got older, he couldn't see himself. And I want you to speak a little bit to have you seen that, and how do you get past that?
It takes a lot of work. It takes a lot of work. Now what we say in the industry, and I hate that term, but I'll use it, is that you've got to get to the root cause of why people are homeless. They may have an addiction, but that's not why they're homeless. The addiction may be why they're homeless, but the reason for that addiction, I have a great slide about the percentage of people who their parents were alcoholics, and what percentage of them became homeless, and what percentage of them were alcoholics. And I think you've got to get to that root cause and be able to have the staff to work through that. That's my answer, is I think you've got to work very slowly to get to the root cause of why that person sees themselves still as homeless. I want to do something real quickly before we end, and that is to really suggest to you, I think that this is a avocation and a vocation that I've had, that God just truly touched my heart in a way that the homeless are my passion. And at one point in time, Reed and I went out to be with the homeless, and at point in time count, and I was sitting on the ground and with these two men who were highly inebriated, trying to get their names and find out a little about them. One turned and threw up all over me, and then that ended the conversation. And we were getting in the car to go home after Reed made me take my pants off because they were disgusting. And he said to me, you know, I don't get how you do that. And I said to him, in my heart, I don't see a difference between those two guys on the ground and myself. I really don't. And what I would suggest to you and encourage you to do is, if you want to go speak to someone in Anacortes who's standing on the side of the street with the board, remember when you go to talk to them that in God's eyes, and should be in your eyes, there's absolutely no difference between that person and you. And even if every time you pass somebody who's standing on the street, all you do is pray for them and remind yourself that there is no difference between that person and yourself, you will be doing them a great service, and yourself as well. So I thank you so much. I hope we have another opportunity to talk, and I hope it's been helpful.
So Bob and Judy had to leave, so Bob ran up to me and said, can you close things down? So, but one thing I would just make an announcement. Next week, we're starting a Lenten study. And I don't remember who's leading it. Someone's leading it next week. We're taking turns.
Is it Ron starting?
I think Ron is starting it. I think so.
Ron's kicking it off, and then there'll be a series of us doing it.
Yeah, so we'll be starting a Lenten study. I would like to pray for Anne and also just for the church. Lord, we're so grateful for Anne. We're so grateful for her willingness to share her heart with us and her mind. And the fact that she is able to embody a deep care for these folks that many of us will look at as if they are undeserving. And Lord, may we see ourselves in each other. And we pray for the community of Anacortes. We pray for the Anacortes Family Center and its work. And even our Dinner at the Brick, that these important things can happen to help us to be a more welcoming, inclusive, and healing community for all of this town. In Jesus' name we pray.
And let me say, I have 15 fact sheets. Sorry, I only have 15. And I can get more made upstairs, but if anybody would like a fact sheet, because it all ran way too fast, please come get one.